Okay, so in this lecture, we're going to go over some of the origin, insertion, and actions of the muscles. And so I'm going to use the skeleton here to point out the different bony landmarks, show you where the muscles start and end, and discuss the actions of the muscles as in what it is that they do, how they help move the body. So the first thing that I want to start off with before I go into the bony landmarks is I want to go over some of the different movements of the body. Okay, so here at the neck, so this is neck flexion, and this is, when I bring it back up this way, that is the extension of the neck. So then if I move to the shoulder, this is shoulder flexion, so going upwards this way. So you can, this is just the elbow, but so this would be shoulder flexion, this would be shoulder extension. So they're opposite movements. So abduction for the shoulder is going away from midline, and then adduction is towards midline. So the type of joint that's here in the shoulder, it's known as a ball and a socket. Okay, so shoulder, and then you also have the scapula. Show the posterior side of the skeleton. And so with adduction, the medial border of the scapula is going to go this way towards midline. If it's abduction, the scapula will move this way, away from midline. If it's elevation of the scapula will elevate upwards. If it's depression, it'll go downwards. Okay, so that's for the scapula. You also have the elbow, so this is elbow flexion, and then this is elbow extension. Also at the spine, so this would be, if I'm in this position and I go forward, this is flexion, and then coming back upwards, this would be extension. Okay, you also have, like in the wrist, this would be flexion of the wrist, and then this would be extension of the wrist. This would be ulnar deviation, radial deviation. You also have pronation. So pronation is when I turn my hand over in this direction, so you pour the soup out. And then if I go this way, this is supination, like I'm holding the soup. Okay, so those are some of the different movements. So now we're going to learn where these muscles start, where they end, and how this allows us to move, and also some of the relationships between muscles, such as antagonist and agonist. Okay, so the first one that we're going to start off with is the muscles that are here in the head. So this part, so you have, this part is known as the temporal fossa, and then this part is known as the angle of the mandible, and this is the ramus of the mandible. The temporalis will go from here at the temporal fossa to the coronoid process, which is right here at the mandible. And then the masseter goes from here, so the zygomatic process and arch, to the angle and the ramus of the mandible. And so both of these muscles, if you think about, I don't want to move this because it's going to alter it, but if I bring the jaw down and then I bring it back up, so what I want you to do is to palpate your masseter muscle. So go like this to your cheeks, and then I want you to bite down. You feel that muscle that's popping out? That's the masseter muscle. So the action of that muscle is to elevate the mandible. So those are the two muscles here at the top. So then moving forward, we have a muscle that's known as the sternocleidomastoid. And so a lot of times the name of the muscle, it describes either like the action, so what it's doing, the location of it. So for example, when I just mentioned the sternocleidomastoid, it has attachments at the sternum, it has attachments at the clavicle, as well as the mastoid process. So let's identify those parts. So the sternocleidomastoid, this is the mastoid process, so it'll start here, and then it'll attach here on the manubrium of the sternum. It'll also attach here on the medial part of the clavicle. So obviously there's two muscles here on both sides, right? They go here and here, here and here. So the action of that muscle, what it's helping to do is for neck flexion. So just think about that muscle shortening and bringing the head in this position. But then if I turn in this direction, you'll see that this muscle, right, the sternocleidomastoid, this is the side that's contracting to bring the head in, to bring my head in this direction. Versus neck flexion, I'm using both of them to bring my head for neck flexion to occur. Okay, so that's the sternocleidomastoid. The next one we have is the pectoralis major. So the pectoralis major is a really big muscle. And so like at the gym, right, you see a lot of people doing bench press, right? So they're trying to target the pec muscles. But before we go over this, I want to talk about the movements. So what I want you to do is to, first off, bring your arm in this position here. So bring your arm out this way. And then put your arm on your pec. So when you go in this direction, so this is known as adduction, you feel the muscle popping out, right? So that's adduction of the humerus, or the shoulder joint. So the pec major, that's what's helping for that movement. Also, if I bring the arm upwards like this, right, the pec is also helping to do that. And so the reason that the pec is able to help move the humerus is based off of where the insertion is, right? Because how can you, in order for you to move the humerus, it has to attach there. So the part where the pec major inserts on, it's right here, which is known as so it's in between both of these tubercles, the greater and lesser tubercles, and this part which is known as the so in between, tubercular, the tubercles, the sulcus. So the intertubercular sulcus. So it'll insert here, and so where it originates, it's here on the clavicle, so here. It's also on the sternum, as well as the ribs. So it's down here. So it's 1, 2, 3, 4, and 5. Yeah, so these 5 ribs, because it's going here and then it's inserting here. Okay, so that's for the pec major. So now let's move on to the deltoid. So the deltoids, that's what helps to move the shoulder joint. Okay, so there's 3 different fibers of the deltoid. So you have the anterior, middle, and posterior deltoid. So for the anterior deltoid, it's on the lateral clavicle, but all 3 of them, so the anterior, the middle, and the posterior, all of them insert on what's known as the deltoid tuberosity, which is right here. So depending on which deltoid it is going to determine the movement. So if it's here in the front on the lateral clavicle and then it attaches here, what motion do you think is going to happen? Is it going to abduct or extend? No. It's going to flex the shoulder because it starts here and then it ends down here. So that's what's helping to bring the shoulder up. But then the one that's in the middle, that goes right here, what is the movement? It's going away, right? So it's abduction. But then the posterior deltoid, that will be responsible for extension. Okay, so the origin, so you have the lateral clavicle for the middle, the acromion, which is right here on the scapula, for the middle, and then the spine of the scapula for the posterior deltoid. And then we already discussed the actions of those muscles. You also have a muscle known as, or a group of muscles known as the rotator cuff muscles. So the rotator cuff muscles help to move the shoulder joint. And so there are 4 rotator cuff muscles. So you have, we call them the sits. So you have the supraspinatus, the infraspinatus, the teres minor, as well as the subscapularis. So if you look on, we'll look at the posterior side first. So this is the spine of the scap, and what's above it is the subscapular fossa, or suprascapular fossa, and then this is the infraspinatus fossa. So the muscle that's here, it's obvious, it's the supraspinatus. The one that's here is the infraspinatus. The one that's on the lateral border here of the scapula is the teres minor. And so all 3 of these, 1, 2, and 3, the muscles that are here, they insert over here on the greater tubercle. So the supraspinatus is what initiates shoulder abduction, but then the so the infraspinatus and the teres minor, that helps with external rotation of the humerus, so bringing it in this direction. So this is, for people that are doing rehab, this is a common exercise that they'll do for rotator cuff repair after they undergo surgery. So that's external rotation, and then internal rotation, you're using what's known as the subscapularis. So sub is like below, like a submarine. So the muscle that's on the subscapular fossa is number 22, which is right here in the front. So that goes here, and that's what inserts on the lesser tubercle of the humerus. And so the motion for that is internal rotation. Okay, so we did the rotator cuff. So now let's move on to the biceps and the triceps. So before I discuss the bony landmarks, I want to explain the relationship between the two. So the biceps brachii and the triceps, they have an antagonist relationship, meaning that they do the opposite things. So the bicep, right, it's here in the front. It goes here, from here to here on the radius. And it helps, if it's here in the front, it crosses the elbow joint. Think about the muscle contracting. Which way is it going to bring the elbow? This way, right? So that's elbow flexion. But the tricep is on the back side. So in order for me to bring my elbow downwards like this, in extension, I use the tricep. So they have an antagonist relationship, meaning that they do opposite things. Okay. Another thing to point out too is that, so this is a hinge joint. So if you know the movements that are at the joints, and you know whether the muscle's in the front or the back on the side, that'll help you to reason and think about what's the action, like what it actually does. Right, if it's in the front, it's typically flexion. If it's on the back, it's typically extension. Okay. So you have two heads for the biceps brachii. So you have a short and a long head. So the short head is medial. It's here on the coracoid process. The long head is on the supraglenoid tubercle. It's supraglenoid because it's above the glenoid cavity. So you have the supraglenoid cavity, and it's also lateral. So just remember, the long head for the bicep is lateral. So they will converge, and so the tendons will come down, right? Because tendons go from muscle to bone, and ligaments are bone to bone. But they'll go down, and then they'll converge at this point here. So this is the radial tuberosity. So yeah, it'll go down here for the biceps, and then for the tricep, it's on the back side. So for the tricep, it goes from the infraglenoid tubercle, and then it's also found on the radial groove back here. And both of them will insert here on the olecranon. So that helps with extension. So the next couple of muscles, so we're going to start on the posterior side. So for the posterior side, you have this part up here. This is known as the external occipital protuberance. And so the muscle that goes from here, it goes like this, and then it's here, and then it's here. So this muscle is known as the trapezius. So you have the upper, middle, and lower. So the upper goes to the lateral part of the clavicle, the middle part goes to the acromion, and then the lower one goes to the spine of the scapula. And so they'll help to elevate the scapula, the trapezius. So if you're at the gym and you see people doing shrugs, right, that's the muscles that they're using. They're using the trapezius muscles to help with that motion. Okay, so we did the trapezius. The next one that we have is the rhomboids. So the rhomboids, it's shaped like a rhomboid, and so it goes like this. So it'll start at the spinous process from C1, 2, 3, 4, 5, 6. So from C7 till T1, 2, 3, 4, and 5 till T5. So it's shapes like this, and then attaches on the medial border of the scapula. So what's the motion when this muscle contracts? Where is it going to bring the scapula? Towards midline or away from midline? Towards midline. So this is adduction. Okay, so that's for the rhomboids. You also have this really big muscle, which is known as the Latissimus Dorsi. So the Latissimus Dorsi has a couple different spots where it attaches. So you have here the spinous processes of, so this is within the thoracic vertebra, and then also on the ribs. So it's here, here, and then as well as here at the bottom, this is the iliac crest. So it'll go here and it'll insert on the floor of the inner tubercular sulcus. And so if it attaches on the humerus, so just think about the muscle. So like at the gym, a lot of people do the lat pulldowns. So the muscle isn't contracted until you're bringing it down. So when you bring it down, what is the movement? That would be AD, so adduction, right? Because it's bringing it towards midline. It also helps to think about it if you go this way, right? I'm extending the humerus, so it's also extension. Okay, so the lats, and then two others that I need to point out. So you have the rectus abdominis and then the quadratus lumborum. So they have opposite functions. So the rectus abdominis, that's where you get the six-pack muscles. So it's here on the xiphoid process as well as the costal cartilages of the ribs 5 through 7. So the rectus abdominis will start here and then they'll insert at the pubic crest. So if you think about it, like when you're doing crunches, what is the movement of the spine? Is that flexion or extension? This is flexion, right? Because the angle is decreasing. But then when I come back upwards, I'm using what's known as the quadratus lumborum. So those also have an antagonist relationship. They do opposite things. So the quadratus lumborum is what's found here. So it goes on, it's on the iliac crest, and then it'll insert on the transverse processes here of the lumbar vertebra. So when you think about that muscle contracting, it'll help to bring this, it's for lateral flexion. Right? So it's bringing it this way. And also for extension of the spine as well, when you use both of them, similar to the sternocleidomastoid. Okay. So, let's see, anything else?